Hello, and welcome to today's research on the top 10 ways to die in the US while waiting for the zombie apocalypse. In 1975, Spielberg's Jaws caused many adults to become disproportionately fearful of sharks. Now, this wasn't an isolated incident. As humans, we tend to overestimate the risks posed by dangers that are easy to imagine and visualize, and underestimate threats that are more realistic. So, if sharks and the upcoming zombie apocalypse don't get us, what will? What are the top 10 threats that we should actually be paying attention to and wary of today? To find out, we looked for data on the top 10 causes of death in the US, and we found an optimal data set at www.data.gov. We cleaned up the data, organized it a bit, and put together an initial visualization. Here's what we found. A few things immediately stood out from this visualization. Number one, death rates were on the rise across the board year over year. Number two, the first and second killers, heart disease and cancer, each accounted for 3 times more death than killer number 3. It wasn't even close. And third point, to our great disappointment, sharks and zombies did not feature in the top 10 cause of deaths. So the rise in death numbers across every category was concerning. Did this indicate a general decrease in public health? To find out, we had to supplement our previous dataset with a new variable, population growth over that same period of time. Our previous data source at data.gov didn't have this information readily available, but we were able to find it on the CDC's website. So we plugged in the population growth and visualized the deaths then as a percentage of this population and not as sheer numbers. Visualized this way, the rate of deaths was a lot less alarming. We then focused our attention on identifying any clear or obvious trends in the dataset. To accomplish this, we performed a preliminary linear regression on each cause of death and looked at it. Some causes of death were a very good fit for this, like cancer, and others, like heart disease, really not so much. Our plan initially was to leverage our dataset to predict deaths for 2024, and then compare our predictions with the actual numbers for that year. However, official tallies for 2024 were not available as of February 2025. The most recent numbers we could find were from 2022, from the CDC. So we ran our projections for the year 2022 instead. Here's how it worked out. Heart disease and cancer came in at number 1, as expected. Unintentional injuries was a surprise number 3, really ballooning far more than we had expected it to. COVID was not at all on the map from 1999 to 2017, and even in 2022, so 2 full years after the initial outbreak, it still came in at number 4 of causes of death in the US. Now, before continuing our analysis, we need to call out one key early finding. We initially believed that our dataset captured the top 10 causes of death year over year in the US. What it actually captures are the top 10 causes of death for the period of 1999 through 2017, meaning that individual years could have had a top 10 cause not featured in our list. Our 2022 dataset included the additional data point of all other causes, which is higher than all top 10 causes combined, excluding the top 3. And this is a glaring omission from our data for the earlier years. So with those caveats in mind, a few things were still very clear. Number 1, only cancer and suicide rates are very linear and can be predicted with great accuracy by a linear regression model. And number 2, external factors not predictable by our dataset, such as COVID, play a significant role in the actual mortality rate of the US population. Nonetheless, we proceeded to uncover what else we could predict from our dataset by leveraging more sophisticated models.
We could say the linear regression doesn't fit all of the diseases. So I'm going to apply the polynomial regression first to say if it's a better fit. So from the result, we could say actually the R-squared value for the heart disease and stroke improves a lot, which means this model can better explain the variance for these two disease. But since the residues are still not randomly scattered, so I'm going to try to apply two different time series models to predict the death counts. The first one is PROFIT, which is developed by the Facebook. The second is autoregressive integrated moving average model. So from the result, I compare the actual deaths in 2020 and the results from the different models. Overall, actually, ARIMA did a really good job to predict the trends. The predicted value is pretty close to the actual deaths. Possibly because of those disease has the past trend, which will influence the future values. Section, we are going to identify the mortality disparity across states. So for all other the economic factors we imported, because the income per capita and median income is strongly correlated, so we will going to drop the income per capita. So from the heat map, we could say the different states show actually very different proportional death rate, with the darker shade showing higher proportional deaths, the lighter shade showing a lower proportional death rate. And we also group the states into regions, which we could say in the south area, there are more states are in the high mortality rate states, while in the West, most states are in the low mortality group. So next, we are going to perform two different analyses using the K-means clustering to group the states by including the economic factors and the region. Since region is a categorical value, so we are going to encode it. The first analysis, we use the proportional death rate with other economic data. And the second analysis, we use the age-adjusted death rate to account for the age difference in the population. We also normalize the other data. Try to exclude the temporal changes on the data set. So we could see the cluster characteristics and we could also say some of the states are pretty consistent within one cluster, but some states can switch between two or three clusters. There are a few states need some highlight, like there are economic health improvement state, DC, New York, Vermont. Some states show a mixed trend, but some states actually show it probably experienced some economic decline, which increased the mortality rate. So from the above analysis, we could say actually high poverty rates plays a very important role in the age-adjusted death rates. And surprisingly, the healthcare actually doesn't really decide the mortality rate. And also the area from the south regions and the rural regions actually show a higher mortality rate.